Greeting everyone. I am Dr. Deependra from Conceptual Orthopedic, and I welcome you all in today's connect session with Professor Ravinder Dimri sir. And today sir is going to continue with table Viva series. Uh, so in this talk today sir is going to discuss the basics of deformity. So I think this is an interactive session. So those who want to participate, you can raise your hand.
Okay, so I gather Mohit. Mohit, can you unmute yourself?
Yes, sir. Good evening, sir.
Good evening. How are you, Mohit? Where are you
I'm
calling from?
I'm fine, sir. I'm from Gujarat. I'm from
Oh, great.
Jamnagar, sir.
Good. So there is one we have added one on the app, but we will try it because this is some difficult concept. And when I was in this, were you there in the PG course?
No, sir. I was not over there, sir. I haven't.
Okay. So a lot of people were asking about this, so we thought we will cover this. So we will cover the basics of deformity correction. So if anybody else want to participate, they're more than welcome. But thank you, Mohit, for participating. Which year are you, Mohit?
Sir, I'm currently working as a senior resident. Just completed.
Just completed. Okay.
Yes.
So, so when you see cases of, let's say, genovirus and genovarum, how do you plan the surgical management of these cases?
First of all, I would like to go. I would like to see that what is the cause of that. If it is the joint is the issue, or it is the distal femur or proximal tibia has any kind of deformity.
Yes, great. Yeah, but what is the traditional teaching? If you got genovirus, which bone to correct?
So the traditional teaching tells that if it is Januvirus, then consider it
Can you
as
hear me clearly, Mohit?
Yes, sir. Yes, sir. I can hear you,
Can
sir.
you come a bit closer to your mic because your voice is slightly faint.
Okay, sir.
Okay,
Then
or
now
speak
am I
slightly
audible,
louder
sir?
or just come close to mic.
Okay, sir.
Yeah, that's better. Okay, so what is the classical teaching?
The classical teaching is that if there is Januvirus, then consider it as osteoarthritis and go for
No, but
the
let's say a young girl come with these deformities. So how do you proceed with your examination? What are you looking? What are the causes?
sir, in young female, I will start from the history of the patient.
Okay.
If it is congenital, or if it is developmental, or it is acquired, so I will go with the history first, and then I will go for the inspection and uh,
Yeah. So
in ins
what is in your mind? Because this is MS exam is almost you have to go reverse. First, you have to have that these are the 5, 6 causes I have to find out from history examination, X-rays. Yes.
Yes, sir.
So the young girl, let's say this is a 14-year girl, both these girls hypothetically, and they
Okay.
got these deformities. So what is going through your mind? What are the causes?
One cause I can think of it is if it is
Sorry to interrupt you, sir. Sir, there is another one candidate, Bidur Sharma. He's a final year resident from Mumbai. He want to participate also.
Great. Yeah. Whether you want to say how do you in the exam, these cases are very common, Genu virus, Genu welcome, especially young children will brought because they're not painful. So Vidur, how do you
Yes, sir.
proceed?
Yes, sir. First, we'll ask the history from the
Again,
parents.
Vidur, you're very faint, so can you come a bit closer?
Hello. Yes, sir. Yes, sir. Good evening, sir.
Yeah. So
Yeah.
where are
Sir,
you calling from, Vidur?
sir, I'm from Bombay. I'm a final year exam going resident within 1 month.
Okay, so if your mic is either far away or the voice
Hello.
is very, very
Am I audible, sir?
depend. Can you hear him properly?
I can hear, but
I'm,
his voice is very low. Bidur, can you? I think you have to check your microphone. Anything? Your sound is not much clear.
Hello.
Yes,
Hello.
that's
Yes, sir.
better.
Audible, sir.
Yeah.
Yes, better.
Yes, sir. Yes, sir. Yeah, good evening, sir. Sir, I'm a final year resident. I'm an exam going student. Next, I'm doing
Yeah, so excellent. So these
deformity.
cases
We'll
will
be
be in your
seeing the.
exam,
Yes, sir. Yes,
varus,
sir.
valgus. Yeah. So how do you, what are the causes for bilateral? What are the causes for unilateral? Let's forget the age. Let's say they can come from any age, a 4 or 5 year old to 10, 15-year-old. These are commonly brought to your exam. Yeah.
We
Vidhu,
try
can you
to
hear me?
elicit. Yes, sir. Yes, sir. Yes, sir. First, we try to elicit the history that when
Yeah.
was the deformity first noted by the parents.
So let's go one by one. So for valgus, what are the cause? For varus, what are the causes? So let's say
Sir,
bilateral.
sir, congenital tibia vera, if in young children, we can see, and then sir, in metabolic diseases, metabolic disorders like rickets, sir, we see.
So first of all, in all these cases, you have to, common thing first. First, you say, could this be a physiological?
Yes, sir. Yes, sir.
So
Yes, sir.
that depend on the age, yes?
Yes, sir. Right, sir.
Yeah. So do you know what is the pattern of deformities from birth till, let's say, 7 year of age?
Yes, sir. First, we have a physiological varus, then till 2 years of age, then it reach. Then there is then 3 to 5 years there is the valgus, and then, sir, then degree of valgus present.
Yeah. And then at around 7 year, you get what the
Yes,
adult
sir.
has, about 5 to 7 degree of valgus, isn't it?
Yes, sir. Yes, sir.
So first of all, you have to see whether this is falling in that pattern in that age group. So
Yes, sir.
physiological is first. For India, I think the second commonest you have to say these tibia, vera, congenital, these come very lower on the list. So next thing you will look is for rickets.
Rickets, sir. Yes, sir.
So any
Yes.
metabolic, and most common is the rickets. Yeah, it could be renal osteodystrophy. It could be and any cause of the rickets, not necessarily vitamin D deficiency, but any cause of rickets. And then the
Yes, sir.
third is not that common, but for bilateral is the dysplasias, skeletal dysplasias.
Yes, sir.
Yes.
And then come unilateral are mainly because of the trauma infection tumor. Yeah,
Yes, sir. Yes,
Yes.
sir. Yes, sir.
Yes.
Trauma. Yes, sir.
trauma infection tumor. So these
And
are the
tumor.
common ones.
Yes.
There can be some other, and for obviously varus, the specific for varus is the Blount disease.
Yes, sir.
Yeah.
Yes.
So these are the common things you need to first have found out. If it is physiological, you don't need to do anything. Not even investigation. You don't want to X-ray of the child. But
Hmm.
if it is not physiological, and how do you know it is not physiological? What are the features suggestive of not physiological?
If it is unilateral, it is not physiological.
Yes, good. Very unlikely it's physiological. Yes. What else?
If it is not correcting with the age, then then also it is not
Yeah,
physiological.
it's not following that pattern of starting with whatever virus, then it's not correcting. There's a standard deviation, but it should overall follow that pattern. Yeah. So good.
Yes.
Yeah. If it is not correcting itself, then it is not, or if it is very severe, which is not explained by physiological. So if you see intermallear distance of about 15 centimeter, then
Hmm.
you know that this is unlikely to be physiological, isn't it?
Yes.
Yeah. So a severe deformity, not following the pattern, unilateral pattern, very asymmetrical pattern. So these are likely to be non-physiological. And then if you're thinking non-physiological, then you get, first thing you get an X-ray in the clinic. An X-ray
Hmm.
can show you if it is dysplasias, epiphyseal dysplasias are common, or other bony dysplasias, or it will show sign of rickets. Yeah. And if it is unilateral, it will show you infection, evidence of previous infection or physeal arrest. These all will be shown in the X-ray. And at the same time, you order some blood tests to rule out metabolic causes, which is mainly calcium phosphate, alkaline phosphatase, and vitamin D level, and sometimes PTH. So these are the common thing you will do. Yeah.
Yes, sir.
And then depending on the these, whatever is the cause of it, the first thing